And it's preparing. Just 1 second. Good. So, hi everyone, and hi Pascal.
Hello, and hello everyone.
Pascal Vidal, who is a doctor and photonic, works with photonic medicine. I will just introduce what I know about you, Pascal, and you can extend on that. I have met Pascal in different places, but the first time I met you was in Pula, in Croatia, at a light congress and from ILA. And it was really amazing. We did an interview, and and we had a good time together. That was really nice. And I know you because you are a student of Pierre Man. Say it again, Pierre Magnan. Magnan?
Good.
Yeah. And I know that you're a doctor and that you work from France and that you are partly French and partly Spanish. And then, of course, that you're coming to Copenhagen to teach in the classroom, and also via Zoom. And this is the 23rd and 24th of November, 2024. So welcome a lot. Is there something you want to elaborate?
Well, so I am very happy and very grateful to you to invite me to Copenhagen to teach. That's the first thing. And I want to thank you both, to you and to Stefan. And I'm very happy to talk about photonics and to have a discourse. Actually, as I'm a doctor, I studied many things. I went through homeopathy, acupuncture, and Auriculoterapi also, and then I came to meet Professor Andy Magnan in 2011 because I was at that time director of a hair acupuncture review, Auriculoterapi review, which is called ICAMAR, and we decided to organize a congress about colors and medicine. And actually, Professor Magnan was leading that congress. And so the first day were theoretical talks, and then I was really excited, and I really appreciate the scientific background that Pierre Magnan brought to his technique. That was the first thing. And then on the second day, there was a workshop time for all the participants who were there. And actually, I could see how he was practicing. And when I saw that, I saw, wow, I understand now why I did auriculotherapy to reach that point and to meet him. And it was really a special encounter we had together. And so I asked him if he was accepting students, so to learn with him, and he told me, of course. So since then, I went from October or September 2011 till November 2020 to learn with him. I was learning. I was going there once or twice a month and staying a few days. So then there was all the talks we were having together, and also he was treating patients. So then I could learn with him. He taught me how to take the pulse, the VAS, the RAC French, and the VAS in English, and to how to assess the VAS and how to take advantage of the information given by the VAS when in front of a patient. And of course, with this collaboration, so he was really sad because he wanted to write a book, but he couldn't because he was suffering some eye problem. He couldn't read and do it properly. So I proposed him to help him. So that's how the first book, De la Chromoterapi à la médecine photonique, came out. I think it came out in 2016. And actually, we wrote 3 more books, which are still to be published because they are not yet finished in the sense of printing and correcting and editing and giving illustrations and that, because that takes a lot of time. And there will be, I hope soon, another book about really the influence of the light at the biochemical level, and which is quite interesting. And we were working together with Pierre for more than 7 years.
Yes,
And,
it was you and Dr. Becu.
and Pierre, in
Yes.
Patrick, yeah. On the first book, we were 3. It was Patrick Becu who helped us to write some chapters and to correct and to read and proofread. And then he wrote a chapter on that book. And then, of course, we were all discussing, the 3 of us, the content of the book and updating it. And then on the second book, which is about to come out, I mean, I was alone with him. And then, so it was a long work of collecting data and studies he had been doing and published. And then, so I hope that will come, that working on a practical book on how to use photonic medicine with patients.
And we hope it will become available in English as well at some point.
Nowadays, with the translation methods that we can have, especially with the website and the AI, that should be easier, I think. Yeah.
Yeah. So let's go to the first question, because we have we don't have a lot of time for this interview. So can you elaborate a bit, what is photonic medicine? Tell us more about what it is.
Well, photonic medicine actually is a diagnostic and treatment technique which can help doctors, for example, to treat a patient. For example, when we have a patient, we will use for the ear, not as in auriculoterapi with needles, but we will take the Vas, the hack in French, the pulse that Nogier rediscovered, and that will give us the information while we explore the ear with an optic fiber with different light. So we use actually color lights from the rainbow, basic colors, and each of these colors have different properties. And actually, Pierre Magnin was, of course, a doctor, he was a pneumologist, he was also a biochemist, which is quite interesting, because then when he was exploring and when he was setting up his technique, he was really trying to understand at what biochemical level each color could work, on which kind of reactions it could be working. And then, so we will explore the here with the pavilion with a basic color, the first color, which is a green, specific green, which will allow us to find out the places where, when we have the rack and the vast perception on these points, where there is a disturbance between in the balance between sympathetic and parasympathetic systems, because we know that when this balance is broken, that's the place where a disease can spread out afterwards. First of all, it will be a functional disorder, and then if the body doesn't manage to bring enough energy to erase that problem, then that will develop in a disease. And so the interesting thing is that for Pierre Magnin, the here pavilion is a kind of interface with the limbic brain, which is carrying the automatic functionings of all the organs. So when we explore the full here pavilion with the colors, it's like we are asking some questions to the brain, whether when we find a disorder, whether there is a vascular problem associated or an inflammatory reaction, or if it's a nerve it's involved, or if it is a metabolic problem, etc. So then according to that, and according to the here chart we use in auriculoterapi, we can say, okay, we have found, for example, a problem in the uterus, while we have a patient, for example, coming from some other problem. But sometimes before the disease become manifest, there is a lot of time in which there is no symptom. So then we have also preventive impact. And then, of course, the aim is to find out where are the places where are all these disturbances, and then we treat them by colors. A color which is producing a pulse disturbance is also treating that disturbance. Then we treat till the perception of the vas fades away.
Can I ask, do you use the colors according to Nogier, or did Pierre develop another system?
Pierre developed a completely different system. Of course, he knew about Nogier because he practiced himself for several years auriculoterapi. But then he I don't know the word in English, but he went away from that because he found out his own meaning of all the colors, and of course, all that will be shown in the class in the course, because it's quite interesting. What to say? The green 54 will manage to detect when there is a bacterial infection, but at the same time, it can also treat some psychological trauma, or do you have my connection yet? Yeah.
Yes, you fall out sometimes. I know that you're in south of France in the countryside, so that's a little challenging, but most of the time you're here, so that's good.
Okay. So
but let's move. So there are specific colors that are treating specific symptoms that are not necessarily related, but if you look at it biochemically, like Pierre did, then there will be a connection, I'm sure.
Yes, of course.
Exactly. Yeah. So let's move to the next question. So the next question is, can you combine photonic medicine with other kinds of therapy? Like, can you combine it? You said you use homeopathy. You're also an acupuncturist. You also do auriculoterapi, which it's already combined with, or other kinds of therapy. Is it possible to combine? Like, would you use these colors on acupuncture points or?
No. So then I don't use this in acupuncture points, but of course it's possible to combine photonic medicine with other techniques. The main thing is that maybe it's not, I mean, photonic medicine can be used alone on its own, and it's giving some real results by its own. But of course, in several situations, it's useful to combine with other techniques, and especially I personally combine it with auriculoterapi and also with reflexology, foot reflexology, that I also learned a lot, and especially on some chronic situations, that would be quite useful also to do it.
So directly underneath the foot?
Yeah, underneath the foot, yeah. And underneath, I mean, on the foot itself, because it's not only underneath, it could be on the sides, it can be on top of the foot also.
Yeah.
But then the thing is that sometimes, according to the clinical is that if you give a foot reflexology massage afterwards, that gets too much information. So then it's better to postpone the treatment. But it's a like of combination, but in time, not at the same day, not at the same moment.
So you combine, but not at the same moment. Or if you do, maybe you do less of one, and can you do that? Or it's better to.
Sometimes I combine at the same time, and sometimes I do not.
Yeah. Also, just a question before I take Vanessa has a question, but I just want to ask, like, because you talk about auriculo and photonic medicine, but you not only use the ear to put the light on, right? You put it on the whole body.
Of course. So that's one the interesting thing is that when we scan the full here pavilion, of course, we get, for example, we have a patient coming from shoulder problem, okay? So we will find the shoulder problem on the here, but also we will find different other situations that could be how to or something which is in preparation. What I want to say is that when we use the here pavilion detection, we will take in consideration the whole body, and everyone is different. So that means that according to the clinical condition of the patient, two patients with the same indication will not be treated completely on the same way. So it's kind of very personalized treatment. And I forgot the question you put me. You just asked me.
Oh, I asked. You're talking about not chromotherapy, but photonic medicine in the ear, but also on the body.
On the body, yeah. The first thing is that to treat on the ear, because to treat on the ear, we are giving some information to the automatic brain, which is carrying the functioning of the organs, and then afterwards we go to the on the body itself, on the areas we have been treating through the ear with the same color combination.
So I have a question. Thank you. I have a question from Vanessa. Vanessa asks, what color filters do you recommend that we should buy prior to the course, especially to those of us who will attend via Zoom? Do you already know what colors you will recommend, or maybe we can send it out to the people participating? Because I think it will be a few filters, no?
So I think it's interesting to begin with few filters, and I think let me just some time to think about it, and I will give you the list of what will be of use of interest for the beginning.
Yes.
Okay.
Okay. So so I hope you got the answer, Vanessa, that there will be a list that will be sent out to the participants for what filters, and we will send it as fast as possible so that you have it before, so you have the filters to work on. Yeah, good. And how long does a session take? And what are the effects typically like? Like what kind of effects do you see, and how long does it take when you give a treatment?
Well, that depends. If it's an acute problem, for example, if you have tonsillitis, for example, that's an acute condition, so the treatment will be quite quick. I mean, of course, you treat, you take, you do the investigation on the full here pavilion like every time, but of course you will be concentrated on the acute problem you have. When it comes to chronic diseases, then the treatment will take more time. Actually, it will be usually for a treatment, I don't manage to be working less. I mean, except from acute problems, I would say in chronic problems or intricate problems, then quite often it's not less than 40 minutes treatment. And then the action, the result, usually we have an immediate effect that the patient perceives, and sometimes, especially in terms of pain or in terms of fatigue, sometimes the patient is really relaxed afterwards, and then he will feel more tired for 1 or 2 days, and then the energy will come up. In painful patients, for example, it happens that the pain can be a little bit increased in the 2-3 next days, but then it will reverse and then it will improve. And the effect, the duration of the effect, it's quite, it will depend also on the frequency of the sessions. For example, when you have influenza, when you have a grippe in French, a viral cold, so then you may treat every 2 days, which is quite often, but that means in 2 sessions it's over.
But that's also acute. That's an acute situation, like with the sinuses. Yeah.
Yeah, that's it. So then you will have 2 or 3 sessions, and then that will be over. While when it's a chronic problem, then of course you don't need to make the patient come every 2 days, but once a week, or sometimes at the beginning twice a week, and then once a week, and then when the patient is improved, then you can delay a little bit more the sessions. Yeah, that's it.
Yeah. So when it's a more chronic situation, you would use maybe 20 minutes in a session, or?
No, not necessarily. It could be even longer. It could be long. In chronic situations, it's quite often long because you have.
No, in acute situations.
Oh, in acute situations, it's quite short. Of course, it's quite short.
Yeah. All right. Thank you. And so we have a question more like, what can participants expect to learn from your course when you come in November in Denmark? Like, what will the teachings around us?
So the teachings will be about. Okay, the teachings will be about how how do we proceed in photonic medicine, and to try to explain how the procedures are in this technique, and of course to understand all the properties of the colors. Even if all of you will not have all the filters, that doesn't matter, but I would like to give a broad information about the use of colors. And because there are colors, okay, that we can use, but there are also colors sequences. That means that when you use, for example, a green 53 plus a green 58 plus a red 25, you will have an anti-edema impact, very strong, which is not, I mean, there are some also combinations that should be known.
And you put them on top of each other, or you have them after each other?
One after one.
One after another. Okay. Interesting.
There are some exceptions in which we can all put them together, but it's quite rare. There are some specific indications. But then there are sequences of colors which have some specific properties. And of course, there is a kind of procedure in the treatment that will be shown. And the aim is to also help the participants to assess the vase, and because that's the basic, the basis which is necessary to really treat properly. Because when we detect a problem, it's through the vase, and then when the vase is fading away, when we apply a color, that means that the body has enough of this information, of this physical energy that we bring through the color, and then we can treat with another one. But the aim is to and then to give you some clues for treating simple things without any, especially like some infectious diseases, some traumatic conditions, some gastroenterology problems, basics that are really helpful. And the interesting thing is that as we do an assessment constantly through the vase, there is no side effect, because, for example, in other techniques which use light, like in photobiomodulation, when we apply the light, which of course is much more intense for a too long period, then we have a reversing, we have a worsening of the situation. But this is
not an overreaction, because you don't stop when the body says, I had enough.
That's it. While here with the vase assessment, that doesn't happen.
That's what's amazing about auriculotherapy, and all in all, just knowing about the vase pulse. This is one of my favorite things about this kind of treatment, is that you listen to the body and you can ask questions, and then you can give what the body asks for, and then when it says it's enough, then you will also know. That's quite amazing.
Actually, it's the vase which is really leading you to treat, and which is telling you what to do and which colors to apply and which not.
Yes. And you can ask the questions like, would you like this or would you like this? And where is there a problem? Yes.
Yeah. Because when you don't know where the problem is coming from, of course, when you explore the full here pavilion, you have some locations which will appear, and then that gives the indications.
Yeah. So how do you see? Yes. Who wants to ask a question?
Yes, it's me, Stéphane. We know that Paul Nogier and Pierre Malien worked with Kodak colors 20 years ago, and we know that now we can't find this color. Do you have the number of Lee filters for solution to get a treatment?
Actually, the solution is double, in the sense that I continue to advise people to get some Kodak filters whenever they can, especially secondhand that you can get through eBay, for example. And there are several sites in the US where we can find these filters. And of course, I am working with a light technician regarding, the waves, which are coming through the lamp, the emission spectrum of each filter. We have made
the color spectrum of the different filters.
The color spectrum of all the filters. They have been studied and done, and I have all the spectrum of them. And then we are trying to find out the equivalent filters in Lee collection, and we have several of them. Not all of them yet, but it's on the way too.
Good.
And I would just say, now that I'm remembering this, that for everybody participating, if you have any filters and you're coming to the classroom teaching, remember to bring them so that you can try and work with your own filters. That would be a good idea. All right. So I have a question more for you, Pascal. And can you tell me what you see installed for photonic medicine? Like, what is the future for photonic medicine? Why is it important at this moment?
Well, I think it's important because nowadays, we are in, how to say, we were previously in the century directed by biochemistry. It was and all the biochemist discoveries lead to understanding the mechanism of bioregulations of metabolism, etc. And also that led to pharmacology and to the building up of medicines. But medicines, as you know, quite usually, especially when they are used for a long period, like in a chronic problems, they have some side effects. And basically also the understanding is that of Pierre Magnin, who was really pneumologist at the beginning, and he was also biochemist, as I said, is that all problems arise from deficiency in cellular or tisular respiration. And then, so nowadays, for example, for the photobiomodulation, the laser therapy, I mean, it's well known that they increase the synthesis of adenosine triphosphate, or ATP, which is the energy medium for all what happens in the body, is really boosted or enhanced by the laser radiation, which uses infrared or near infrared information and quite a strong potency, so then they can go deep in the tissues. So I would say that we are beginning to enter in an area of treatment by frequencies, by energy, by information. Each color can carry an information, you know. Modulation will use infrared and near infrared but we use photonic medicine, use the colors from the visible spectrum, while infrared is not visible, you know. And the interesting thing is that when you are on the outside, the light of the day is constantly changing, and all these changes are or to aid the biochemic reaction, you know. For
example, the light, you had a fallout. So the light that we get from the sunlight and the daylight, it changes.
It changes. It's not monotonous. It's quite changing constantly, and all these changes will help and will maintain and sustain all the biochemistry of the body, because we are exchanging things with the outside, and then the light we bring from outside is carrying energy to us, and then it maintains the physiology of the body. So that's quite interesting, because all the light we can see outside are from the visible spectrum, and the light we are using in photonic medicine are also the same, actually, the basic. You know, Pierre Magnin was having this image that I liked a lot, kind of poetic image. He said that when we are healthy, the light from the outside, that means the white light, is enough to maintain the body and to bring energy to the body. While when there is a storm, that means when there is a disease, then it's when the rainbow appears. So then that's when the colors are useful. And that was his way of telling the things. And that's how we came to understand and to study, actually, how the colors and the light were able to work. And of course, he gave a lot of explanations that I can develop then with you, because it's quite interesting, because we are really on the verge of entering in a new field of medicine, actually.
I remember having a talk with him, because I went to several courses with him, and he said exactly what you're saying, that you can perceive the light when you are in a healthy balance. You can perceive all the colors of the light, all the colors we cannot see, and everything coming with the light. You will heal from that. And when you are in a deep imbalance, then it's difficult for the body to use the colors for your health benefits if you have blockages in your body. So this is something that is very important to know, that you can heal from light, but if you're not able to, if your skin and your body is not able to take it in and use it because you're too sick, then you have to help go directly to the body on specific areas and with specific colors, instead of the broad spectrum of all the colors.
That's it.
Yeah.
That's it. Yeah. And the interesting thing is that, of course, when the body is disturbed, when there is a disease, it's quite often disturbance of balance between oxidation and reduction at a chemistry level, you know. That means there is an exchange of electrons in the molecules or in between the atoms, which is disturbed. And one of the way of acting of the light is that when you put the light on the body, of course, you will all the electrons who are free will be able to be carried at a long distance to reach the point where the blockage or the imbalance or the disease is. So then bringing electrons to that area will help to restore the oxidation reduction balance. Then it will help to remove the acidity which is there. It will help to remove all the, how to say, in French, the most unnecessary chemical reactions who are taking place. And then
can you say it again?
It gives some
we didn't
order.
hear that. Can you say again in French? You say what? You call it? It's all the trash from the cell.
All the waste
yes.
From the metabolism, you know. So
exactly.
That will get locally. That will get rid of that. So then it will begin again functioning, you know, and.
It will detoxify the cells and breathe new life into the cells so that they will work more efficiently and that they can help heal and repair the body.
And also the synchronization of all what's happening on the cell, the coherence all between the cells and the organs will be restored because of input of the energy brought by the light.
Yeah. I wrote about DNA. That DNA was the main localization for the when you target with photon, it's going to your DNA. So that's why it's very powerful, because that means it's going for all your cells when you practice with colors.
And the energy is stored actually in the DNA between the helix. Is the location which the photonic energy, the energy coming from photons is stored actually, and then that means that it's available later on for other things. Yeah.
Thank you.
Thank you so much, Pascal. It was so nice that you took time. Yes, thank you that you took time this evening to enlighten us about light and colors and photons and all the amazing things that that light and color can do. So thank you very much for taking this time.
Thank you so much.
And we're really happy to see you in Denmark in November. What did you say, Vanessa?
Oh, it was just saying thank you. Thank you so much for doing this, also to you for hosting him.
Thank you. Thank you very much. And we're looking forward to see you in the classroom via Zoom. And I hope to see all you other guys on Zoom or in the classroom maybe. And have a very wonderful evening. And thank you.
Thank
you.
All of you.
Thank you.
Bye-bye. See you soon.
Bye-bye.
See you soon.